Good morning and welcome to Radio Friends on Tuesday, May the 28th. We're going to talk about Mental Health Awareness Month. May is designated as Mental Health Awareness Month, and I want to introduce you to Dr. Laine Young-Walker from MU Health.
Well,
good to have you here, Doctor.
Thank you very much.
And you were on with us on the old Pepper and Friends show many years ago.
That's what people tell me that have better memories than me.
All right. What do you want to get across about mental health and Mental Health Awareness Month?
Well, I think it's really important that everyone be able to talk about and recognize that mental health is important as physical health, and that there not be the stigma associated with it where people are suffering with depression or anxiety and not talking to somebody about it.
Because some people think that if you have a mental health problem, that you need to hide it, and that's not true.
Yes.
If you hide it, then you're covering up the symptoms, which can get worse. Right. But if you bring it out in the open and say, I've got a problem, I need to talk about it, I need some help, that's better, right?
True, because we know now that many of the mental illnesses have a biological basis. There are treatments, there are medication treatments, and there are therapy treatments that can help you feel better. And so if you hide it and don't get help, then you're just suffering for times that you could feel better and do better.
Do most mental health issues stem from biological problems?
So it's a combination. There's an innate biological predisposition, so a family history.
What do you mean by that?
So mom and grandma all had depression that had to be treated. So chemical serotonin, norepinephrine, they're low in that family who is predisposed to depression. But then there's environmental things, such as stressors and things in life that happen, that the person can't compensate for. And so it's a combination of the biological and the environmental.
How do you know if you're suffering from biological depression or environmental depression?
So the reality is it typically is a combination of both, and there's no test that shows you that you have a low level of serotonin. There are some tests that are done through research that let us know that that's typically the case. And the treatments help that, and so you see an improvement in symptoms because you're giving someone serotonin, and now their body is normally at the right level, and they're no longer having depression.
What is serotonin?
Serotonin is a neurotransmitter in the body produces it.
And if we don't produce enough of it, we can become depressed.
Exactly.
Can you overprescribe it and you get too much serotonin?
So there are some side effects that can come with all medications, and too much serotonin can cause a side effect that's called serotonin syndrome.
Like what?
Usually that is like muscle aches and fatigue, feeling really sick.
But not overly joyous.
No.
It doesn't take you that way.
No, it doesn't.
Yeah. Okay. It's really an interesting topic, and you can't cover everything that needs to be discussed in a 4 or 5 minute segment. We've got about a minute left. What is the most important message you want to get across to people?
I want to make sure that people know and understand that there is support, there's help, that if you reach out to mental health professionals, they can help you with therapy and or medication. And there's lots of activities going on this month just to raise awareness. There are different activities at the hospital this week for mental health awareness, and also at Cosmo Park there's going to be a Family Fun Fest event. Okay.
There is nothing to be ashamed of. If you feel that you have a mental health problem, the most important thing to do is reach out for assistance because it's there. How do they get in touch with someone at university?
So they could contact the hospital operator who could connect them with the MU Psychiatric Center, and that could give them some support, or else they could contact our outpatient clinic.
Can we, if we're feeling depressed, are we able to talk ourselves into happiness?
Some of that can help, but often you need more, depending on the severity. That's why you need to see a mental health professional.
Okay, if you have any questions.
Yes.
Okay. Doctor, thank you so much for coming by. You can call the university main switchboard, and they will refer you in the right direction.
Yes.
All right. Thank you so much. Dr. Laine Young-Walker, MU Healthcare.
Thank you.